From deadly outbreaks to presidential controversy, this week's top health headlines could reshape the way we think about medicine and public safety. What do these events mean for us? Let's break it down. The World Health Organization has confirmed a lethal new Ebola outbreak in the Democratic Republic of Congo's Kasai province. As of this week, at least 48 people have been infected and 31 have died, including frontline health workers. Surrounded with dense forests, limited healthcare, and complex humanitarian challenges make containment extremely difficult, but vaccination efforts are underway. More than 900 contacts are being actively monitored, and the approved Ervebo vaccine is being deployed to protect those at highest risk. With the outbreak still contained in remote regions, global health officials say the risk outside DRC remains low, but continued vigilance is essential as this deadly virus can linger and resurface years later. Now, in a stunning turn, President Trump used a White House autism event to link Tylenol, commonly used during pregnancy, to increased autism risk, as well as renewing unsupported claims about vaccine safety. Listen to some key highlight for autism announcement.
I always had very strong feelings about autism and how it happened and where it came from. And he and I don't know, the word got out, and I wouldn't say that people were very understanding of where we were, but it's turning out that we understood a lot more than a lot of people who studied it, we think. And I say we think because I don't think they were really letting the public know what they knew. The meteoric rise in autism is among the most alarming public health developments in history. There's never been anything like this. It used to be 1 in 20,000, then 1 in 10,000, and I would say that's probably 18 years ago. And now it's 1 in 31, but in some areas it's much worse than that, if you can believe it, 1 in 31. And I gave numbers yesterday. For boys, it's 1 in 12. I was told that's in California, where they have for some reason, a more severe problem. So since 2000, autism rates have surged by much more than 400%. Instead of attacking those who ask questions, everyone should be grateful for those who are trying to get the answers to this complex situation. And the first day all of these great doctors behind me were there, I told them, this is what we have to find out. You know, there's something artificial. They're taking something. And by the way, I think I can say that there are certain groups of people that don't take vaccines and don't take any pills that have no autism. That have no autism. Does that tell you something? That's currently, is that a correct statement, by the way?
There are some studies that suggest that, yeah, with the Amish, for example.
The Amish, yeah, virtually. I heard none. See, Bobby wants to be very careful with what he says, and he should, but I'm not so careful with what I say. But you have certain groups. The Amish, as an example, they have essentially no autism. We'll say there are parts of the world that don't take Tylenol. I mean, there's a rumor, and I don't know if it's so or not, that Cuba, they don't have Tylenol because they don't have the money for Tylenol, and they have virtually no autism, okay? Tell me about that one. Hepatitis B is sexually transmitted. There's no reason to give a baby that's almost just born hepatitis B. So I would say wait till the baby is 12 years old and formed and take hepatitis B. And I think if you do those things, it's going to be a whole different, it's going to be a revolution in a positive sense in the country. Acetaminophen, is that okay? Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good. The reason they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. That's, for instance, in cases of extremely high fever, that you feel you can't tough it out, you can't do it. I guess there's that. A Tylenol, but it'll be very sparingly. It can be something that's very dangerous to the woman's health. In other words, a fever that's very, very dangerous, and ideally a doctor's decision, because I think you shouldn't take it. And you shouldn't take it during the entire pregnancy. They may tell you that toward the end of the pregnancy, you shouldn't take it during the entire. And you shouldn't give the child the Tylenol every time he's born and he goes and has a shot. You shouldn't give a Tylenol to that child. All pregnant women should talk to their doctors for more information about limiting the use of this medication while pregnant. So ideally, you don't take it at all. But if you can't tough it out, if there's a problem, you're going to end up doing it. We want no mercury in the vaccine. We want no aluminum in the vaccine. The MMR, I think, should be taken separately. This is based on what I feel the mumps, measles, and all the three should be taken separately. And it seems to be that when you mix them, there could be a problem. So there's no downside in taking them separately. In fact, they think it's better, so let it be separate. The chicken pox is already separate, because when that got mixed in, I guess they made it for a while, it really was bad. So they make chicken pox. Individually, they're okay. When you mix them, something maybe happens. So there's no downside in doing it. It's not like, oh, if you do it, bad things. No, it's only good side. And it may not have that much of an impact, but it may have a big impact.
His statement prompted swift condemnation from pediatricians, obstetricians, and autism experts. The World Health Organization and multiple peer-reviewed studies, including a landmark 2024 analysis, report no credible evidence tying acetaminophen to autism or related disorders. Medical bodies globally warn that discouraging the use of Tylenol and urging changes to the childhood vaccine schedule puts millions of children at risk for preventable illnesses and needlessly alarms expectant mothers. Both EU, WHO, health experts urge parents to continue following established vaccine and medication protocols, stressing that misinformation could endanger public health. Now turn our focus to America, where health authorities report a dramatic 31-fold surge in measles cases across 10 countries in the Americas, totaling more than 11,300 confirmed infections and 23 deaths as of mid-September. Among the countries affected, Canada has been identified as the hardest hit, accounting for more than 4,800 cases and 1 death. Mexico has reported a similar burden, with over 4,500 cases and 19 fatalities, while the United States has confirmed more than 1,400 cases and 3 deaths. Together, these 3 nations represent 96% of all confirmed cases in the region. The Pan American Health Organization says this spike, up from just 358 cases last year, underscores the danger of falling immunization rates and the risks posed by vaccine misinformation. Experts warn that diseases once nearly eliminated could make a deadly comeback if vaccination coverage falters. With Ebola spreading in Africa, measles resurging in the Americas, and vaccine controversies shaking public trust at the highest levels, and health news this week is a wake-up call. So what does it mean for us? That science, trust, and truth matter more than ever. For updates on global outbreaks, medical breakthroughs, and the politics of health, make sure you subscribe to Health Bulletin.